This is Nicole Freeland for Nursing 101. Today we will be discussing Module 3, Medication Administration, including safe administration and error reduction, patient education, and routes of administration. Your objectives for Module 3 include to list factors that decrease medication errors, accurately describe the role of the nurse for patient medication education. You should be able to identify proper techniques for safe medication administration, and you should be able to compare and contrast routes of medication administration. First, we'll discuss an overview of medication errors. It wasn't until 1999 when the Institute of Medicine released a report called "To Err is Human" that the public was aware of medical errors, really. It's estimated that annually medication errors affect 7,000 individuals, leading to death each year, and 3% to 6.9% of hospitalized patients will incur a medication error during their stay. The link provided to you will take you to an overview of the report called "To Err is Human," and then it provides you with links that you can click on to read the specific chapters in that report. So let's talk about what medication errors are. First of all, an adverse drug event is a general term that encompasses all types of clinical problems related to medication use, including medication errors and adverse drug reactions. Adverse drug reactions are unexpected, unintended, or excessive responses to medications given at therapeutic doses. There are two types of adverse drug reactions. The first is an allergic reaction, which is often predictable, and an idiosyncratic reaction, which is usually unpredictable. Medication errors are a common cause of adverse healthcare outcomes and can range from having no significant effect to directly causing patient disability or death. It's important to consider all the steps involved in medication use system when discussing medication errors. Identifying, responding to, and ultimately preventing medication errors requires an examination of the entire medication use process. Next, we'll discuss error reporting. A very important key to preventing errors is the reporting of errors itself, and then the reporting of potential errors as well. It's been shown that reporting and sharing of errors can prevent the same error from occurring again, and it is imperative that the reporting of errors not be punitive towards the reporter. Many healthcare institutions have moved from a non-punitive environment to one of just culture. Just culture is an environment where, after a systematic review of an error, discipline is applied appropriately. Just culture recognizes that competent professionals make mistakes, but acknowledges that professionals may develop unhealthy habits as well, such as taking shortcuts. Staff members are held accountable for their actions involving such habits. However, when error is related to a system or a process, the staff members are not held accountable. All hospitals are required to analyze medication errors and implement ways to prevent them. And nurses must take the time to report errors or potential errors because without reporting, no changes can be made. When errors are reported, these trends can be identified and processes can be changed to prevent the errors from occurring again in the future. Nurses must rely on individual policies and procedures of the institution at which they are working. Now let's talk about some issues that may contribute to errors. Medication errors can occur at any step in the medication process. This includes procuring, prescribing, transcribing, dispensing, administering, and monitoring of medications. Half of all preventable adverse drug events begin with an error at the medication ordering stage. And then administration is the next most common point in the process, followed by dispensing errors and transcription errors. It's very important for nurses to have a good relationship with pharmacists because these two professions work together and can have major impact in preventing medication errors. Some common causes of errors would be misunderstanding of abbreviations, or possibly these abbreviations have a double meaning. These abbreviations should be avoided at all costs. Illegibility of the prescriber handwriting. Oftentimes, many practitioners do not take the time to write legibly, which can lead to medication errors. Never assume that you know what someone's handwriting says. Always call for clarification if you cannot read that individual's handwriting. Miscommunication that can occur when you're taking a verbal order or a telephone order. This is why you should always repeat the order to the practitioner before hanging up with them. Confusing drug nomenclature, so just not understanding the order itself. And there can also be errors in the home setting. Errors occurring in the homes can be quite harmful because potent drugs that were once only used in the hospital setting are now being prescribed for outpatient use. The majority of fatal errors at home involve the mixing of prescription drugs with alcohol or other medications. Intangible losses resulting from adverse outcomes include patient dissatisfaction and loss of trust in the healthcare system. So this in turn can lead to adverse health outcomes because patients then become afraid to seek healthcare services. Some medications that are commonly involved in errors include central nervous system medications, anticoagulants, and chemotherapeutic medications. Near misses must also be considered in the process of identifying and addressing medication errors. A near miss is defined as a situation that is not distinguishable from a preventable adverse event except for the outcome. The patient is still exposed to a hazardous situation, but without harm, either from early detection of the error itself or through luck. The Agency for Healthcare Research and Quality, or AHRQ, defines a near miss as an event or situation that did not produce patient injury, but only because of chance. It is important to note that near misses must still be reported by the nurse. So medication errors are considered to be any preventable event that could lead to inappropriate medication use or harm. There are categories for medication errors. The first one would be no error, although circumstances or events occurred that could have led to an error. So this is also a near miss event. Medication error that causes no harm, a medication error that causes harm, and a medication error that results in death. So some strategies to prevent medication errors. You need to make sure that you have multiple systems of checks and balances in place for your medications. This includes the nurse's triple check, the pharmacy verifying the medications for you, verifying the order, med reconciliation. All of these are multiple systems of checks and balances for medication safety. You need to make sure that your orders are legible. You need to make sure that you can read them. As I stated before, if you are unable to read your orders, you do need to contact the provider for order clarification. The nurse needs to make sure that they are consulting current authoritative resources. So whether that be a drug guide that is that was published within the last 3 to 5 years, or you are contacting the pharmacist for clarity or any concerns that you have, you need to know where to access these resources. And then, of course, the nurse's triple check of the order before administration, and then using your 6 rights of medication administration every time. So now we'll talk about some ways to prevent medication errors. As the first step to defend against errors, you need to assess information about the drug and the patient, including the medication to be given, any drug allergies, the patient's vital signs, and any laboratory test results. You should always use 2 patient identifiers before medication administration. Never give medications that have not been drawn up or prepared by yourself or are prepared by someone else and not properly labeled. Always make sure to label your medication after you draw it up. You need to make sure that you minimize the use of verbal and telephone orders. If they are used, be sure to repeat the order to confirm with the prescriber. You need to speak slowly and clearly and spell the drug name aloud. List the reason for each use of the drug on the medication administration record and any educational materials used. You should always clarify orders when necessary. Never assume anything about a drug order or prescription, including the route. If a medication order is questioned for any reason, you need to clarify the order. Do not attempt to decipher illegible written orders. Don't go to another nurse and you both stare at it sideways and you question what the handwriting says. This can almost certainly lead to a med error. Just call the physician and clarify the order. You should never use trailing zeros in writing and transcribing medication orders. And with that being said, you always need to use leading zeros. These both can lead to improper dosages, which is in fact a medication error. You need to make sure that you remain current on your education as a practitioner. You should always use generic names of medications to avoid errors due to sound-alike drugs. And then always make sure that you honor the patient's concerns. Oftentimes, the patients are right when they tell you they have never taken a medication before, or they cannot take this medication because of other medications that they are taking. So whenever it is questioned, always then go back and verify that this is in fact the correct drug that has been ordered for this particular patient. If need be, you can call the practitioner and notify them of their patient's concern. Some more ways to help prevent medication errors. Please remember to maintain your own health. You cannot take care of others if you cannot take care of yourself. Strive to maintain your own health, to remain alert. Never be too busy to stop, learn, and inquire. In addition, engage in ongoing continuing education. You should be considering becoming a member of a professional nursing organization so that you can network with other nursing students or professional nurses to advocate for improved working conditions and to stand up for the rights of nurses and patients. Safeguard any medications that the patient had on admission or transfer so that additional doses are not given or taken by mistake. If such situations should occur, safeguarding is accomplished by compiling a current medication history and resolving any discrepancies rather than ignoring them. You also need to ensure the weight of your patient upon admission. This will help with correct medication dosing. And then make it mandatory to recalculate doses for high-risk medications and do a double check with another nurse. When you are drawing up medications, minimize interruptions, and then always make sure to educate your patient over the medications that they are being administered. One point in time where medication errors are highly likely to occur would be a transition of care. Transition of care is a term that describes the movement of a patient from one care facility to another facility or to home. Most errors that occur during the transition of care stem from poor communication between the healthcare providers. Medication reconciliation is a process in which medications are reconciled at all points of entry and exit to and from a healthcare entity. Medication reconciliation requires patients to provide a list of all the medications they are currently taking, including any herbal products and over-the-counter medications. And then the prescriber is then allowed to access those medications and decide if they are to be continued upon transition. There are 3 steps of the medication reconciliation process. The first one is verification. This is when collection of the patient's medication information with a focus on medications currently used, including prescription drugs as well as over-the-counter medications and supplements, are gathered. And then there is clarification. This is professional review of this information to ensure that medications and dosages are appropriate for this patient. And then the third step is reconciliation. This is when further investigation of any discrepancies and changes in medication orders can occur. As the nurse, we need to ensure ongoing accuracy of medication use. Now we'll move into patient education over medications. Patient education is essential in any healthcare setting and is a critical component of quality and safe healthcare. Without patient education, the highest quality and safest of care cannot be provided. Patient education is also very crucial in assisting patients family, significant others, and caregivers to adapt to illness, prevent illness, maintain health and wellness, and provide self-care. Patient education is a process, much like the nursing process. So, as a nurse, always create a safe, non-threatening, non-distracting learning environment for your patient. Be open and receptive to the patient's questions as well. And you can use the following strategies to help ensure an effective teaching learning session. You can begin the teaching learning process upon the patient's admission to a healthcare setting. You should individualize the teaching session to the patient. You can provide positive rewards and reinforcement, like verbal affirmation, after accurate return demonstration of a procedure, a technique, and/or a skill during the teaching session. You can assist your patient with completing a medication calendar that includes the names of the drugs to be taken, along with the dosage and the frequency. You can use several different teaching methods, such as audiovisual or other learning aids that are specific to that patient and their learning style. And then you want to involve caregivers, involve family members, significant others in teaching sessions so that they can help the patient as well. The patient education process begins with assessment of your learner, development of appropriate human need statements, planning, implementation, and evaluation. Patient education may be one of the more satisfying aspects of nursing care because it is essential to improved health outcomes and may be easily measured. So in that first step of the assessment of the learner, you need to gather information, both subjective and objective, about your patient. This can include their age, any barriers they may have to learning, such as cognitive abilities, their compliance with current or previous therapies, their cultural background, their education level, their home environment. Financial status can have an effect on medications. The language that they speak can have an effect on education over medications. Any other medications they're currently taking, they need to be aware of. They need to have a motivational level. Any past and present health behaviors. Their religion, religious beliefs, and spirituality can have an effect on patient education. Then we'll talk about the development of a human needs statement. Some of these statements related to learning and drug therapy are autonomous choice, effective perception, an individual's self-esteem, self-actualization, self-control, and self-determination. Human needs statements that may be appropriate to learning needs develop out of objective and/or subjective data showing that there is limited understanding, no understanding, or misunderstanding of the medication and its actions. The planning phase of patient education includes the teaching learning process, and it occurs as soon as the learning need has been assessed and then identified with the patient, family, or caregiver. With mutual understanding, the nurse and patient identify outcome criteria that are associated with the identified human need statements and are able to relate to them to the specific medication the patient is taking. Implementation of the patient education process occurs after you have completed the assessment phase, identified the human needs statements, and created a plan of care. The implementation phase of the teaching learning process begins. This phase includes conveying specific information about the medication to the patient, their family, and/or their caregivers. Teaching methods and sessions must always accommodate the priorities of the patient. Teaching learning sessions must incorporate clear, simple, and concise written instructions, oral instructions, and written pamphlets, pictures, videos, or any other learning aids that will be used for patient learning. And then we have the evaluation phase of the patient education process. Evaluation of learning outcomes needs to also be consistent with the identified domain of learning. Evaluation of patient learning is a critical component of safe and effective drug administration. To verify the success or lack thereof, ask specific questions related to patient outcomes and request that the patient repeat information or give a return demonstration of skills if appropriate. So some strategies that you can use to enhance patient education and reduce barriers to learning include working with available educational resources in the nursing field and the pharmacy area to collect or order and distribute materials about drug therapy. Make sure that written materials are available to all individuals within the healthcare team and are prepared on a reading level that is most appropriate for your patient. Be sure that written and verbal instructions are available in the language most common to your patient. Perform a cultural assessment that includes questions about level of education, learning experiences, past and present successes of therapies and medication regimens, core beliefs, value systems, meaning of health and illness, perceived cause of illness, family roles, social organizations, and health practices or lack thereof. Provide information over the patient's specific medications. Make sure you are working within the healthcare team. And never wait to discharge patients to teach them. Begin education upon admission. Some general teaching principles to keep in mind when you are providing patient education are to make sure learning patient-centered and individualized to each patient's need is considered. This includes assessment of the patient's cultural beliefs, educational level, previous experience with medications, level of growth and development, support systems, resources, their preferred learning style, and level of sophistication with healthcare and healthcare treatment. Adult learning principles include learning that is related to a need or a deficit. It is patient-centered, and is reinforced by application and prompt feedback, with the nature of learning changing frequently. New information should draw on past experiences. You should assess the patient's motivation and readiness to learn. If they are not motivated or not ready to learn, you should probably revisit patient education at a later time. Make sure there are no deficits to learning, such as the patient is in pain, or groggy from surgery. If those are cases, then you should wait to provide patient education at a later time. If your patient is illiterate, they still need to be taught. You can provide education materials that include pictures. You can demonstrate things to them and have them return demonstrate, and just emphasize on the instructions. Again, you should consider, assess, and appreciate the language and ethnicity during patient teaching, and make every effort to educate non-English speaking patients in their native language. You should assess their support system for adequate patient teaching, family living arrangements, financial status, resources, communication patterns, the roles of the family members, and the power and authority of different family members must always be considered as well. If at all possible, make the teaching simple, easy, fun, thorough, and effective, and try to provide the most up-to-date information available. Now we'll move into discussing proper techniques for safe medication administration. The first thing that you should know are your standard precautions. These should be followed with every patient, regardless of situation. Remember to perform hand hygiene after removing gloves, between patient contacts, after procedures or certain cares are provided, and when leaving the patient's room. Wear clean gloves when exposed to or when there is potential exposure to blood, body fluids, secretions, excretions, and any items that may contain these substances. Wear a mask or eye protection if splashing or spraying of bodily fluids is a possibility. When administering medications, once the exposure or procedure is completed and exposure is no longer a danger, remove soiled protective garments or gear and perform hand hygiene after removal. Never remove, recap, cap, bend, or break any used needle or needle system. Be sure to discard of any disposable syringes and needles in the appropriate puncture-resistant container. Okay, so now we'll move into discussing routes of administration. The first one that we will discuss is oral medications. First off, you need to perform your necessary assessment specific to the medication that you are giving. What is your patient's pulse rate? What is their blood pressure? What are their respirations? All of these things should be assessed if the medication that you are giving can have an effect on those systems of the body. You also need to ensure that your patient has the ability to swallow and that their gag reflex is intact. If your patient is suffering from dysphagia or the inability to swallow, some medications may be crushed. You need to verify that your medications that are ordered can be crushed. So you either need to call the pharmacy again or check your drug guide. You can never crush sustained release or extended release medications. Another medication that you should never crush is potassium. When you go to give oral medications, make sure you position your patient in a sitting or a side-lying position so that they are able to swallow and do not aspirate their medications into their lungs. You need to offer a full glass of water to your patient. You can place the medication directly into the patient's mouth with your gloved hand, and you do need to remain with your patient until the medication is swallowed. And then make sure that you document all medications that are given. Sublingual and buccal medications. The sublingual and the buccal routes prevent destruction of the drugs in the gastrointestinal tract and allow for rapid absorption into the bloodstream through the oral mucous membranes. These routes are not often used, and be sure to provide instruction to the patient before giving these medications. Sublingual tablets are placed under the tongue. However, the buccal tablets are placed between the molar teeth and the cheek. Be sure to wear gloves if you are placing the tablet into the patient's mouth. Instruct the patient to allow the drug to dissolve completely before swallowing. These drug forms are not taken with fluids. Instruct the patient not to drink anything until the tablet has dissolved completely. Be sure to instruct the patient not to swallow the tablet, and saliva should not be swallowed until the drug is dissolved. Orally disintegrating medications. Either in tablet or medicated strip form, dissolve in the mouth without water within 60 seconds. These meds are placed on the tongue, not under, as in the sublingual route. The absorption through the oral mucosa is rapid, with a faster onset of action than for drugs that are swallowed. The patient must be instructed to allow the medication to dissolve on the tongue and not to chew or swallow the medication. Be sure to wear gloves if you are placing the medication on the patient's tongue. Make sure the patient has not eaten or had anything to drink for 5 minutes before and after taking these medications. Orally disintegrating medications are often packaged in foil or blister packs. Do not open the package until just before giving the medication, and be sure that you peel the package back. Do not try to pop the pill through the blister pack, as they are easily broken. You cannot split, break, or tear these medications, and these meds should never be chewed or swallowed. Liquid medications may come in single doses, unit dose packages, or may be poured into a medicine cup from a multi-dose bottle. When you go to pour the medication, Make sure that you always shake the medication gently to mix the contents. And then use the appropriate calibrated device. So if you are going to give a medication that is less than 5 milliliters, an oral syringe is necessary for administration of this medication. If it is more than 5 milliliters, a medicine cup may be used. Make sure that when you measure the medication, you are doing it at eye level so that you know that the dose is appropriate. All right, the nasogastric or the gastrostomy route should always be done in the semi-Fowler's or Fowler's position. You should always assess whether fluid restriction or fluid overload is a concern for your patient, because it will be necessary to give water along with the medication so that you flush the tubing to avoid clogging of the tubing. Check to see if it is recommended for the drug to be given on an empty or a full stomach. Whenever possible, give liquid forms of drugs to prevent clogging of the tube. If tablets must be given, you need to crush the tablets individually into a fine powder and administer the drugs separately. Keeping them separate allows for accurate identification if a dose is spilled and avoids issues with drug incompatibility. Before administering the medications, follow facility protocol for verifying the tube placement. Often this is done by auscultation. Dilute a crushed tablet or liquid medication in 15 to 30 mils of warm water. Pour the diluted medication into the syringe and then allow gravity to let the medication flow into the tubing. If gravity is not working, you may apply gentle pressure to instill the medication into the tube. After each dose of medication, you should flush with 10 milliliters of warm water. And after all medications are administered, you should flush with 30 milliliters of warm water. You need to make sure that you also document the amount of fluid used on their I&O. And then the patient needs to remain in the Fowler's position for at least 30 minutes after drug administration. The rectal route, always assess the patient for the presence of active rectal bleeding, diarrhea, or hemorrhoids, as this can interfere with medication administration. You should never divide suppositories so that you can give smaller doses to a patient. Make sure that you position the patient on his or her left side, unless they're not able to do so. And the uppermost leg needs to be flexed towards the waist. This is called the Sims position. Make sure that you provide privacy. Also make sure that you provide proper lubrication so that administration is not painful. Use a gloved hand to insert the medication against the rectal wall 4 inches beyond the internal sphincter. Then have the patient remain lying on his or her left side for 15 to 20 minutes after administration to allow proper absorption of the medication. You may also allow your patient to self-administer this medication if they are able. You need to ensure that you provide proper education over medication administration before the patient self-administers. Intradermal injections. When giving an intradermal injection, you need to keep in mind of the following. You need to be sure that you choose an appropriate site for the injection. You should always avoid areas of bruising, rashes, inflammation, edema, or skin discoloration. You need to help the patient to assume a comfortable position. Extend and support the elbow and the forearm on a flat surface. Cleanse the site with an alcohol or an antiseptic swab. And allow to dry completely before continuing. Once the site is dry, you may stretch the site with your non-dominant hand, and with the needle almost against the patient's skin, insert the needle bevel up at a 5 to 15 degree angle until resistance is felt, and then advance the needle through the epidermis, approximately 3 millimeters. The needle tip should still be visible under the skin. Never aspirate in an intradermal injection, and then slowly inject the medication. It is normal to feel some resistance, and a bleb that resembles a mosquito bite should appear. Do not massage the area. Withdraw the needle slowly while gently applying dry gauze to the site, and bandage if necessary, and dispose of the needle and syringe appropriately. Subcutaneous injections. These are injections that are administered into the subcutaneous space. We need to be sure to choose an appropriate site for the injection. Again, avoiding areas of bruising, rashes, inflammation, edema, or skin discoloration. You should ensure that the needle size is correct. To do this, you grasp the skin fold between your thumb and your forefinger and measure from top to bottom. The needle must be approximately 1/2 of this length. Cleanse the site. Allow to air dry. Tell the patient that he or she will fill a stick. For an average size patient, you will inject at a 45 degree angle. For an obese patient, you will inject the needle at a 90 degree angle. If you choose to use the abdominal site, you need to stay 2 inches away from the umbilicus. Once you insert the needle, grasp the lower end of the needle with your non-dominant hand and aspirate. If no blood is seen within the syringe, you may inject smoothly. Then you withdraw the needle quickly, cover the insertion site, do not massage the site, educate the patient not to massage the site, use the airlock if it is in place within a syringe. Some doses of heparin or Lovenox will have air within the syringe. This is to ensure that the medication stays in the injected site, so do not expel the air from a syringe. And when you go to give insulin for a subcutaneous injection, always ensure that you are using an insulin syringe. 1 unit of insulin is not equivalent to 1 ml of fluid. For intramuscular injections, again, make sure that you choose the appropriate site for injection by assessing not only the size and integrity of the muscle, but the amount and type of injection. Palpate potential sites for areas of hardness or tenderness, and note the presence of bruising or infection. Also know that the dorsogluteal injection site is no longer recommended for injections, but may still be used by some practitioners. Assist the patient into a proper position. Locate the proper site for injection. And then cleanse the site and allow to dry. When you cleanse the site, you will apply the alcohol swab or cleansing swab at the center of the site and cleanse outward in a circular direction for about 2 inches, and then you will let the skin dry. Keep a sterile gauze pad nearby for use after the injection. Next, with your non-dominant hand, you will pull the skin taut. Grasp the syringe with your dominant hand as if holding a dart and position the needle at a 90-degree angle to the skin. Warn the patient that they will feel a stick as you insert the needle. Insert the needle quickly and firmly into the muscle and grasp the lower end of the syringe with your non-dominant hand while still holding the skin back to stabilize the syringe. With the dominant hand, pull back on the plunger for 5 to 10 seconds to check for blood return. If no blood appears in the syringe, inject the medication slowly at the rate of 1 ml every 10 seconds. After injecting the drug, wait 10 seconds and then withdraw the needle smoothly while releasing the skin. Cover the site with a bandage and discard of your needle and syringe appropriately. Now we'll discuss some topical medications. The first one that we will discuss are eye drops. Before you administer any kind of eye medication, make sure that your patient is not wearing contact lenses. If they are, you need to help them remove those. Then you will have the patient sit in a supine or sitting position and tilt the head back slightly. With your dominant hand resting on the patient's forehead, hold the eye medication dropper 1 to 2 centimeters above the conjunctival sac. Do not touch the tip of the dropper to the eye or with your finger. Drop the prescribed number of drops into the conjunctival sac. Never apply eye drops directly to the cornea. If the drops land on the outer lid margins, repeat the procedure. For eye ointment, gently squeeze the tube of medication to apply an even strip of medication of about 1 to 2 centimeters along the border of the conjunctival sac. After installation of eye medications, ask the patient to close the eye gently. Squeezing the eye shut may force the medication out of the conjunctival sac. A tissue may be used to blot liquid that runs out of the eye, but instruct the patient not to wipe their eyes. You may apply gentle pressure to the patient's nasolacrimal duct for 30 to 60 seconds with a gloved finger wrapped in a tissue. If multiple eye drops are due at the same time, then wait several minutes before administering the second medication. Eardrops. After explaining the procedure to the patient, assist the patient to a side-lying position with the affected ear facing up. If earwax or drainage is noted in the outer ear canal, remove it carefully without pushing it back into the ear canal. Remove excess amounts of cerumen, which is earwax, before installation of the medication. If the medication is refrigerated, warm the ear medication by taking it out of the refrigerator for at least 30 minutes before administration, as cold drops can cause nausea, dizziness, and pain to the patient. For an adult, pull the pinna up and back. For an infant or a child younger than 3 years of age, pull the pinna down and back. Administer the prescribed number of drops. Hold the dropper 1 centimeter above the ear canal and direct the drops along the sides of the ear canal rather than directly onto the eardrum. For applications of lotions, creams, ointments, and powder, apply them to clean, dry skin. Have them turn his or her head to the side during application to avoid inhalation of powders. Apply lotion to clean, dry skin. Remove residual from previous application with soap and water and then pat dry. Before administration of any dose of a topical skin medication, ensure that the site is dry and free of irritation. And then for transdermal patches, be sure that the old patch is removed as ordered so that the patient is not receiving excess amounts of a medication. They can actually overdose on a medication. Make sure that site is cleansed and dry where you are going to apply it, and do not apply to an old patch site. You need to rotate sites of application with each dose, so it's important to document the site of application. And transdermal patches need to be applied at the same time each day if they are ordered daily. The old patch can be pressed together and then wrapped in a glove as you remove the glove from your hand and dispose of it in the proper container according to facility policy. Next, we'll discuss some inhaled drugs and nasal drops and sprays. First off, a variety of inhalers are available, so you need to be sure to check for specific instructions from the manufacturer, because improper use will result in inadequate dosing. So when using a metered dose inhaler, shake the metered dose inhaler gently before using, remove the cap, and inspect the mouthpiece to ensure that there are no foreign objects in the mouthpiece. Inhalation of a foreign object could cause serious injury. Hold the inhaler upright and grasp it with the thumb and first 2 fingers. Tilt the patient's head back slightly. If the inhaler is used without a spacer, have the patient open his or her mouth. Position the inhaler 1 to 2 inches away from the patient's mouth, or the patient may place the inhaler mouthpiece in the mouth with the opening toward the back of the throat. Have the patient exhale completely and then press down once on the inhaler to release the medication. Have the patient breathe in slowly and deeply for 5 seconds. Have the patient hold his or her breath for approximately 10 seconds and then exhale slowly through the nose or pursed lips. To use a nebulizer. Some healthcare facilities use an air compressor that is located on the wall, while others will actually use a nebulizer machine. Nebulizer treatments may be performed by respiratory therapists or a nurse. Always closely monitor the patient before, during, and after the drug administration. Be sure to take the patient's baseline heart rate, especially if a beta-adrenergic drug is used, as these drugs will often increase heart rate. After gathering the equipment, add the prescribed medication to the nebulizer cup. Some medications may require a diluent. Be sure to verify that before adding the diluent. And have the patient hold the mouthpiece between his or her lips. Before starting the nebulizer treatment, have the patient take a slow, deep breath, hold it briefly, and then exhale slowly. And instruct the patient, if they are short of breath, to hold their breath every 4th or 5th breath for 5 to 10 seconds. Then you will turn on the small volume nebulizer machine and instruct the patient to repeat the breathing patterns mentioned previously during the treatment. Occasionally tap the nebulizer cup during the treatment and toward the end to move the fluid droplets back to the bottom of the cup. You need to ensure that you stay with the patient throughout the treatment to ensure that the nebulizer medication is properly administered. Monitor the patient's heart rate during and after treatment. If inhaled steroids are given, instruct the patient to rinse his or her mouth with water afterwards, as these can irritate oral mucosa. After the procedure, clean and store the tubing per facility policy, and make sure that you document medication administration. Nasal medications. For nasal drops, hold the nose dropper approximately 1/2 inch above the nostril. Administer the prescribed number of drops toward the midline of the ethmoid bone. Repeat the procedure as ordered, instilling the medication in the indicated number of drops. Keep the patient in the supine position for 5 minutes. For nasal sprays, while the patient is sitting upright, occlude one nostril by pressing a finger against the outer nair. After gently shaking the nasal spray container, insert the tip into the other nostril. Point the spray tip toward the side of the nose, not toward the center, and squeeze the bottle into the nostril while the patient inhales. Repeat the procedure as ordered, instilling the indicated number of sprays per nostril. After administration of nasal medicines, offer the patient tissues for blotting any drainage, but instruct the patient to avoid blowing their nose for several minutes after installation. Assist the patient to a comfortable position and make sure that you document the medication given. Lastly, we will discuss the vaginal route of medication administration. It's important to note that vaginal suppositories are larger and more oval than rectal suppositories. Please explain the procedure to your patient thoroughly before beginning. You should administer the medication at bedtime if at all possible, which allows for maximum absorption of the medication and keeps it from leaking out of the vaginal vault. Allow a patient to self-administer the medication if they are able. Educate the patient over the correct procedure before giving them the medication to self-administer. Provide privacy for your patient, and then have them position in the lithotomy position and elevate the hips with a pillow. That concludes today's module. So for your post-lecture questions, you need to answer the following 4 questions and submit these to Moodle before the end of class today. If you need more time to complete your post-lecture questions, please reach out to me and we can discuss that. I know that today's lecture is a long one. However, if you are able to complete these on time, you should. Remember that late work is not usually accepted, so please follow instructions carefully. Thank you all, and have a great afternoon.